Hi, everyone. Thank you for joining me on yet another episode in the series Conversations with Shelley. You, of course, tune into that segment of my channel where I speak about my journey on a GLP-1 slash GIP in the form of either Monjoro, being the branded version of the medication, or compounded tirzepatide, which I get from a number of compound pharmacies. I am now on um, pomegranate via BPI, and we'll talk about all of that in my next episode. Love BPI, they're coming out of circulation in terms of compounding the drug, so I'm a little bit concerned with that. But this is not the channel and not the episode where I'll be speaking about that. I'll do something subsequent where I'll be speaking about my weekly updates. For those of you joining me for the first time, I'm Shelley. Welcome. Always a pleasure for you stumbling upon this little channel. And for those of you who've been here with me at least for the last 36 weeks in total, 27 of which have been my active um, weight loss journey slash, metabolic health. And week 11 or week 10 of my maintenance journey. Now, I wanted to do something a little bit different for this episode simply because I have been moved by a lot of the conversations and the narrative that have been surrounding GLP-1s within the social media space. And sometimes, with even little pockets of conversations that I'm a part of, or may just be, in earshot of. And it has been very concerning. I mean, for many reasons than one. And that is what has brought me here to want to discuss and to hopefully put some, you know, different points of view across so that we can understand the space a little bit better and not to treat it in such of nonchalant, almost kind of a way. So let me just put some frame as to what my discussions and conversation will be, particularly so when it comes to this episode. So I want to start off by, you should be able to see the topic by now, but let me just resonate what my topic is clearly. Now, for me, let me just um, turn off my phone so that I'm not distracted. Right. So for me, this topic for this week is, why is everyone secretly on a GLP and won't admit it? And I think my topic is very controversial and provocative because this is exactly a question that a social media influencer, and as per usual, I won't call any names because I'm not about that particular consideration, but this is a question that was asked by this content creator. And it is a question that quite a number of persons within the social media community have been asking. I've seen it on TikTok, I've seen it on YouTube, I've seen it on other social media spaces. So I wanted to put a different narrative and to kind of bring some seriousness to the conversation of what GLP-1s are so that we are stop, making it out to be something that is supposed to be a trend or a fab, as the case may be. And I'll speak from a personal um, space and hopefully, can shed some light into something that should be treated with a little bit more respect than how a lot of persons within the space have been looking at GLP-1s. So you'll probably notice in your own little, pockets of groups that you may have that people are losing weight and they're losing weight rapidly. And it's not just a few individuals that you may see, but it is a wide cross section of persons within the social media space, within your workplace, and even within, as I said, your own circle. Now, here is the strange part about it. Not everyone is openly saying how they are able to lose the weight so rapidly. There's no clear explanation, and in most instances, while the method is not obvious to a lot of us, the transformation is. So then the question becomes, for me, what is actually happening and how a lot of persons have been able to address their minds to what it is that is visually being seen. No, again, is it a question of, you know, discipline? Is it a question of willpower? Is it a question of lifestyle change? Is it a question of medication? What exactly is it? No, because there is this silence behind it all. There's a powerful, and I will say this from my own personal experience. There's a powerful class of medical treatment that has been quietly reshaping weight loss in modern society. But not everybody understands and not everybody will agree with how it is being used. Now, before I go into the point of view that I want to shift and change, why this is a part of the provocative conversation, is to explain to you what GLP-1s are in actuality. Now, GLP-1 medications are a class of drug originally developed to treat blood sugar regulation and metabolic diseases such as Hashimoto, PCOS, diabetes, those kinds of metabolic conditions. And what they do in essential, everyday language is that they mimic a natural hormone that is already in your body that affects and signals, conditions or circumstances surrounding appetite, digestion speed, and fullness signals. So, in simple terms, these medications actually reduce the constant hunger cues that many people struggle with, particularly those who also suffer from the condition of obesity. Now, for individuals living with either a metabolic condition or suffer from the condition of obesity, both of which are progressive and chronic conditions that in most instances can significantly improve your health outcomes and have them properly be supervised. These medications are things to be considered, right? As I mentioned, they're not to be treated as a trend or a fad, as I'm now seeing within this space. But the conversation, the narrative, the understanding of them should shift into the realm of the narrative and the discussion and the discourse that we're having to surround the medical settings, right? So again, why does it feel like everyone is using it and nobody is speaking about it? And I'll dive into this because, as I said, if you are approaching these medication as they should, for the conditions, for the medical conditions of obesity, for the medical conditions of metabolic issues, then it should not be a secret. Yeah? So on social media, it can feel like a sudden wave of transformation because you wake up today, somebody who was a size 14, 16, 18, 12, have now dropped weight so fast and so drastic with having these consistent and, as I said, dramatic results that what you are seeing appears to be some visibility bias because you're saying to yourself, it can't be a normal approach to weight loss that is taking place here. Because, of course, your mind and the mind of a lot of persons who are thinking that this is some secret that should be, kept and not be explored, is that the results that are being shared are so dramatic and progress is not subtle. And the explanation that you're hoping to get from people is often missing and misleading. So the narrative for you and for others who are questioning the need for medications like this, the serious need for medication like this, grows louder than what actually should be. Now, first of all, it is going to start to feel for you who are questioning, what is taking place, that everyone is on this thing. And of course, statistically, I am not sure what the numbers say. But what needs to be understood is that a lot of persons are either stigmatized and silenced because they're not approaching the medication in the right way or how the medication was intended to be approached. Now, as I said, the stigma and the silence in of it is one of the biggest reasons people don't openly speak about their GLP-1 use. Because for decades, society has framed, weight loss to be something that is supposed to happen by willpower and by discipline and effort and all of those things. And a lot of persons within the space that you're questioning how dramatically they've lost weight is because, as I said, they're not doing it for the right reasons. You have somebody who just wants to look 5 pounds lighter or 10 pounds lighter. Persons in those situations are not the persons who these medications are designed to assist. These medications are designed for persons living with the condition of obesity that is now considered to be a chronic and progressive disease in consideration to other metabolic conditions, as I mentioned, the PCOS, the Hashimoto, the diabetes, the insulin resistant persons who otherwise without this medication will be living a different reality. So I am here to change the narrative about those persons who are doing it for the wrong reasons. And if they are, and I may have to take this back, they really should be put on blast because you don't need the medication for those trendy moments that you're trying to achieve, right? Those 5 pound losses and those 10 pound losses. Please understand, these medications are serious medications. They come with some serious side effects and in instances some serious contraindicators, which means that there are persons who these medications should never be prescribed for. And unless you're treating with it in that particular way, your side effects will be severe. And I will repeat, there are particular contraindicators that should be treated with the utmost of respect outside of you wanting to fit into a particular size clothes to lose a 5 or 10 pounds. So I will say for those persons, yes, they should be shamed because it is not the purpose of the medication. It was not intended to deal with those circumstances. And as a result, you wouldn't want to talk about it because you're in it for the wrong reasons. But for persons who are on it for the right reasons, there should be no shame and stigma attached. It is a medication like any other medication that was prescribed for your particular and specific circumstance and condition. And therefore, you should not feel ashamed or stigmatized or silenced into not speaking about it. And that is one of the reasons why I am an advocate for GLP-1s, because I suffer from insulin resistant conditions. I suffer from metabolic indicators that without this medication, I would have been having a different conversation with you today, right? So there's no hiding or secrecy for me here. This is not intended to be a fab for me and several others of us within the community. So instead of saying I am losing weight and I'm exercising and presenting that narrative that a lot of persons don't even understand, I'm talking about changing your lifestyle because you have a severe, progressive, and chronic condition. It's not about excuses. It's not about a trend. It's not about a fab. Now let us talk about the misuse and off-label use of these medication because there are lots of it happening. As I said, a lot of persons are doing it for the trend, for wanting a little 5 minutes of, you know, going through an experience. And I'm deeply affected by those instances because a GLP-1 medication is not to be popularized or traditionally used in the way that it is being used for a lot of persons who are silenced about it. Because on one side, the legitimate treatment for these metabolic conditions require prescribed circumstances where you speak to a doctor, you do your blood work, you go through prescribed clinical supervision and long-term health management. So if you're looking at it for an off-label use for cosmetic weight loss, right? Use that are driven by appearance pressures or minimal clinical evaluation in many cases, that is creating a growing tension between medical treatment, and its aesthetic enhancement. And that is one of the reasons why, when these medications came to the fore, a lot of persons in Hollywood were the only ones who could afford it, to the detriment of the persons who really needed it. And nothing has significantly changed about that, save and except that the medications have become a little bit more affordable. That for those who want to use it for the cosmetic off-label use, the use case has become significantly more. And it is not just relegated to those who are within Hollywood, but the everyday man with no metabolic conditions and no real medical need has no access, because it has become a little bit more affordable. But there are still instances where persons with the need for the medication are experiencing issues. Maybe not a shortage, as the case may be when it just came out, but issues that are affecting insurance coverage, because persons are utilizing the drugs or misuse utilizing the drugs, as the case may be. And these inappropriate use, off-label aesthetic use without medical need, puts a pressure on those persons who are truly affected and who may need it the most, to reduce these long-term metabolic health conditions. Then there's also this concern that I have, that I can't even express how inappropriate it is, for persons who lack medical supervision and supervision to be doing this purely for the commercial activity and commercialization that goes along with it. Because now we are seeing the demand increase. We're seeing access to GLP-1 medications have expanded rapidly through a lot of gray market, um, you know, access, private med spas or clinics, a lot of, subscription-based services that are not tied to any medical approved system. So while this has improved accessibility for persons, it has raised concern about reduced clinical oversight. And that is where I have a major and significant issue. Because in traditional care, patients typically receive their full medical evaluation on these medications, their ongoing monitoring, their dose adjustment depending on the side effects and the management of it. So for me, for it now to be something that is so commercialized, misused, and in most instances significantly lacking medical supervision, you can't imagine how upsetting that can be. But in more cases than not, a lot of these persons who are just commercializing a GLP-1, you need to be mindful that you may be significantly putting somebody at risk, right? So while there's commercial models that are happening, please, for those persons who are sensitized to these commercial um, you know, instances, be advocates for yourself. Understand that these are serious medications. And if there's no medical supervision that is attached to these sales or access of this medication, be very, very wary. Because consultation, though it is necessary, it's not happening. So the concern for me that arises from commercialization of the weight loss medications, whatever form they come in, it should be something that we are concerned about beyond what is happening within our spaces. And social media and the pressure that is there to have these off-label uses needs to be regulated. It needs to be something that is less visible as it now is, because this creates a layer that surely will not be good for someone who doesn't have a medical need particular or these particular medications. So while the transformations are happening and they're publicly happening, I will say the silence and the stigma should come from those, or there should be stigma and silencing of those that are using these medications wrongfully, because this is the only way that it will reduce what is happening to persons that are being impacted significantly by the real side effects that are not being treated within a medical space. So, silence and stigmatization will form part of the protection that is necessary. It will form part of the protection that is necessary. And what it really means is that the real story isn't that everyone is secretly on a GLP-1, because those of us who are on it for the right reasons don't hide that we are. The real story is that society is undergoing a medical shift to things that are aesthetic and commercialized. And the world is moving towards weight loss and obesity and metabolic conditions in the wrong way. So, a world that should be driven by biology, medicine, and behavioral science is not happening. And that is why there's silence and nobody is talking about it. Now, as I said, I don't have the statistics as to what it will be, but certainly the question of is GLP-1s being used for the right reason is clear as day for me. It's clear as day for me. And how we talk about these medical tools should happen without stigma. It should happen without misunderstanding. And it certainly should happen without pressure. Because as I mentioned, it is being done and it's happening for the right reasons. So, if this made you think differently about GLP-1s, and if this allowed you to see a different point of view as to what may be happening statistically within your space, in seeing almost every other person on a GLP-1, ask yourself the next time you see somebody losing weight drastically, are they on the medication for the right reasons? And maybe that should be the question you ask. Instead of asking, are you on a GLP-1? Maybe you should ask, are you on a GLP-1 for a metabolic reason? I think that's a question that I would ask. No. Is it appropriate for you to ask anybody anything? Absolutely not. So a person has the right to answer and to answer you in accordance to how you've asked your question. But if I were brave enough, which I think I am, to ask anybody that is experiencing dramatic weight loss, I would ask the question, are you on a GLP-1 for the right reasons? There has to be some extrapolation of that question. It can't just end at, are you on a GLP-1? Certainly not. Yeah? So, if this resonated with you in any way, I ask that you like, share, subscribe, and comment. Because at the end of the day, we need to break down modern health and psychology within society and certainly within social media. So thank you once again. I had to do this one outside of my standard GLP-1 update because this is something that was sitting very deep within my spirit and within my soul. So until I see you on the next one, do take care.